And we are talking with Dr. Cathy Naughton with the Incontinence Institute. She's the director also of the Center for Sexual Health. A lot of people just don't talk about, but is really a pretty common occurrence, and that is erectile dysfunction.
Thank you for having me.
Yeah, thanks for being on the show.
Sure.
So first off, can you speak a bit about, I had read that, with the National Institute experience erectile dysfunction on a long-term basis in 15 to 25% of 65-year-old men. Can you talk a bit about just on how common?
If you look at overall prevalence rates, it'll probably be close to 34-35%. And according to the goes significantly higher after the age of 50. So men in their 50s, 60s, 70s, and, we're living longer now. It's going to be more men in the United States are suffering from this.
Wow. Okay. Now, what about, the causes of, about just lifestyle factors that there's so many things that can influence it, and so things like smoking, being overweight, even like marijuana use and stress and anxiety, all things that can, contribute to it or exacerbate. Can you
erectile dysfunction, I get a lot of men with questions, why is this happening to me? What is the reason? And as you pointed out, erectile dysfunction is a marker of good health. So in my mind, the four pillars of good health are good diet. And so if all those things are optimized, erections are going to be better. And if you think about it, if you're sick as a dog, the last things you mentioned, smoking, obesity. Obesity is an epidemic in our country. Over 67. We have a program here. It's called Food as Medicine because my philosophy in general is least invasive to most invasive. So if you can, it's always better.
Mm-hmm. Now, can you explain a bit about how just something like smoking or being overweight or cholesterol levels and alcohol use?
Right. So the buzzword is endothelial damage.
Okay.
There is a link with erectile dysfunction and one of the big messages that I want to put forth is erectile dysfunction is an early marker for heart disease. So common risk factors, as you mentioned, smoking, but hypertension, diabetes, high cholesterol. In British studies, they estimated about a 3 to 4 year lag time where a man will present with ED first before a cardiac is not a priority. If a man presents with erectile dysfunction, he should seek medical counsel to make sure.
And I also read like stress and anxiety, play a role.
Patients, especially if they're young, will be blamed that the erectile dysfunction is quote unquote all. Sexual health involves a psychological component. We are human beings. For some people, it's 5% of the problem. For other people, it's anxiety. That releases chemicals, true chemicals that bring the erections down, that constrict the vessels. And you need vessels such as Viagra, Levitra, Cialis. It's sort of a seesaw game where those medicines try to keep the chemicals around longer. Anxiety, smoking, those tend to constrict the vessels.
So is this common with smokers then?
Yes. Very common. Change the labels. Yes, absolutely. If they would change the labels on cigarettes that this can cause ED in the future, people
change the Surgeon General.
Yes.
Wow. So how common is it with smokers?
I would say a signature that in terms of is there definitive studies, but even partial erectile dysfunction, it is erectile dysfunction, and it's dangerous. You can fracture your penis, you can have hematomas, bleeding, and that could eventually lead to curvature of the penis or pyrexia.
Now, can you talk about just a bit basic, you kind of covered it here and there, but just the basic, causes of ED, and you touched on it a bit, but,
right.
And then, what do you do when if it is an issue and you have to go to the doctor and get treatment?
Right. So one of the main primary doctor, especially if you're younger, the younger you are, the more likely you'll have some other medical issue. In terms of, decreasing fast food, sodas, just to have a healthier diet and be in an ideal body weight. Most patients will report higher libido, and it's been shown that exercise is linked to improvement or intense exercise. It's better than doing, moderate exercise. Of course, you want to check with your physician before you get into a program. But you need adequate sleep for regulation of hormones, and if you're tired, you're not going to want to have intercourse. It's a physical activity. If you measure in the amount of exertion that's used for intercourse, it's more than. Sex can sometimes be a risk for a cardiac event, and so that should be evaluated. And the fourth thing is whether it's massage, going, anything that would help. Some people resort to acupuncture.
It sounds like exercise would be good because then you're getting kind of a double whammy there, and it's going to help you with your stress, and it's going to help physically. That's
exactly right. You exercise, then you get better sleep. You want to eat better, and it's a good cycle.
Now, go ahead.
I was just going to ask, at least when you're watching television, for one of the medications that's supposed to help with this problem, do you have, are your patients kind of like, well, just give me that?
All the time, all day long. Because even though people don't want medications, they want a quick fix. And all these things we do, dedication and commitment to do that every single day. And to see changes, it may take longer than trying a pill. When we talk about treat function, one of the oral medications you alluded to, Viagra, Levitra, Cialis, you can actually use a vacuum, like Austin Powers, the vacuum pump. It really is.
Wow.
It really is a medical device, and it was originally designed keeping the erection with the rubber band and using that.
That sounds really romantic.
I know that it's very cumbersome, and it's not ideal. Strong believer in you don't use it, you lose it, and so I'm
all for penile preservation.
Right, I encourage sort of like exercise organ. Then we have medications that we can actually put into the tube that you pee through, and that medication dissolves through that lining in the penis. There's surgery to actually put a prosthesis in, and that is shown to be the most satisfactory treatment.
Yeah, drastic.
Yes, but if you think about it, people get artificial knees all the time, and so this is an artificial... I'm sorry?
Don't tell your friends about that one, though.
Right. But it's very important when you're evaluating, after you, because, it takes at least two people to establish a sexual relationship. And so, I may be very successful in B, then the relationship will suffer.
Yeah.
It will not be optimized. So I treat the female as well. We have female sexual dysfunction. We alluded to that a little bit last time I spoke, but it's very important. And we give talks on this all the time. It's free November 6th at the Center for Sexual Health. So feel free to call our number and look at our website. And
what is the website?
If you call the number, we can reserve a spot. It's 314-315-9965.
Okay.
315-9965.
9965. And what is on your talk on November 6th? What is that going to cover specifically?
That's going to be treatment. I encourage partners together. And then on the female side, I talked about this last time, but we're having the Sex, Wine, and Chocolate seminar.
Yeah. Oh, yeah.
I was going to ask you about that.
For the Sex, Wine, and Chocolate is $15 per person. And the number is different. 7997.
7997. Okay.
Right. So, it's just you can bring back to your caregiver and say, I really would like this evaluated and managed.
Now, I have a quick question just on, you mentioned how does that work? Because obviously, with an erection, it's not like you want that all the time.
All the time. That's right. There's actually has three parts. It's a three-piece penile prosthesis. The three parts include a reservoir that's filled in the groin area, sort of where a hernia would be.
Okay.
And that's connected to a scrotal pump. It's a little connected to two cylinders that replace the penile shaft. So when the patient does not want an erection, whenever he wants to have an erection, or she wants to have an erection, he just pumps up the scrotal pump, which transfers...
that sounds pretty complicated. I'm going to say that, if this is an issue, maybe this is a really good time to get that exercise and stop smoking.
Yeah. It's definitely, something that is not for everyone, but we have to give patients available. So you don't have to suffer. And, again, you don't have to do the most aggressive thing, but you should be evaluated.
So you take a very holistic approach to it, which is nice.
Yeah,
because it sounds like it's really a complicated problem.
Very.
Yeah.
Now, for Center for Sexual Health, we've been talking about erectile dysfunction. Any last things that you'd like to add that people should know about this?
The last, pelvic health. So even in men, if you have symptoms of urgency, frequency, getting up at night, call the Incontinence Institute, directions as well.
Okay. All right.
So very important.
Well, Dr. Cathy Naughton, thank you very much, and we'll keep an eye out for these events. So, and then also the treatment options for erectile dysfunction on November 6th, also both of those at the Center for Sexual Health. And if we go to the Center for Sexual Health,
and call the numbers.
Okay.
Those are going to be the better way, but always, you can always refer to the website too.
Okay. All right, Dr. Cathy Naughton, thank you for some good information on prevention and treatment. This is really helpful.
Thank you.
All right, thanks so much. Have a great afternoon.